Ladies and gentlemen, good morning. I'm Lai Yaxin from the Department of Endocrinology and Metabolism, the first affiliated hospital of China Medical University. Today, we are going to learn the clinical manifestations of Cushing syndrome. The most characteristic clinical manifestations of Cushing syndrome include central obesity. You can see the fat accumulation is very obvious on his face, abdomen, and trunk, but his upper extremities and lower extremities are relatively thin. And buffalo hump. You can see the dorsal cervical fat pad is very obvious for this boy and just look like the buffalo, so we call this sign buffalo hump. And moon face and sanguine complexion. You can see the color of his face is red and just like the full moon, so we call this sign moon face. Or small purple stream. You can see the typical purple stream are red to purple in color and depressed below the skin surface. So these are the most characteristic clinical manifestations of Cushing syndrome, which includes central obesity, buffalo hump, moon face, sanguine complexion, and purple stream. And now, let's come to other clinical manifestations of Cushing syndrome. We all know that overproduction of cortisol can affect many organs. For example, for fat accumulation, overproduction of cortisol can cause fat redistribution and cause central obesity, weight gain, buffalo hump, and moon face. For protein metabolism, increased protein catabolism may cause muscle weakness, sanguine complexion, purple stream can be seen all over his body, and easy bruising. For the glucose metabolism, we all know that cortisol is a kind of hormone that can elevate blood sugar. So in patients with Cushing syndrome, they may have impaired glucose tolerance. Sometimes when the blood sugar is very high, he may suffer from diabetes mellitus. For the electrolyte, we all know that cortisol has similar effect as aldosterone. So in this kind of patient, they may have hypertension and peripheral edema and hypokalemia. For the immune system, we all know that overproduction of cortisol can inhibit the immune system. So in this kind of patient, they may suffer from infection and impaired wound healing. For the gonad, we all know that cortisol overproduction can inhibit FSH and LH secretion. So in this kind of patient, for male patient, they may have erectile dysfunction, and for female, they may have menstrual disturbance. And in zona reticularis, it can secrete adrenal androgen. So when it is involved, this patient may have hirsutism and acne. For the muscle and bone, patients with Cushing syndrome may have muscle atrophy and osteoporosis, which means the bone density is very low. And for the bone marrow, cortisol can increase red blood cell and white blood cell. For the mental system, excessive cortisol secretion can increase emotion lability and euphoria. And for the skin, especially in ACTH-dependent Cushing syndrome, for example, ectopic ACTH syndrome. In this kind of patient, the ACTH level is very high, so they may have hyperpigmentation of the skin.